there were a couple of studies that I highlighted from, actually, they were just published in the past couple of months, looking at the use of blood-based biomarkers for prognostication in early Alzheimer's disease. And so comparing a few different isoforms of plasma tau in particular, as well as A-beta, neurofilament light, and a few others, it appears that p-tau in the blood is going to be our best predictor of cognitive prognosis, not only in terms of what happens to, say, objective measures of cognition, say the trajectory of your MMSE score, but also predicting that conversion to the dementia threshold. So largely these were populations with either subjective cognitive complaints or mild cognitive impairment. So we're able to watch and see how things played out over a period of time. In one study, it was about 5 years of follow-up, and another 6 years of follow-up. And so they were able to monitor these biomarkers when they became positive, and what that meant for the trajectory of cognitive decline. One study compared this plasma p-tau 181 with several other biomarkers, and they found that that one was the most superior. However, their C-index for predicting incidence of AD dementia was only 0.73, and that was less than what their C-index was for a clinical reference model. So it raises some questions on whether or not that one is even superior to what we can get from a clinical reference model that includes things like demographics, education, and a few cognitive scores. The other study, however, looked at a few different ways of measuring plasma p-tau. The p-tau 181 was included, but there was also another one, p-tau 217 and 231. Using those as well as other plasma biomarkers, they found that p-tau 217 was actually the most effective. And they also compared that to a covariates only model, and it was superior to their covariates only model. So it seems that that one is probably a stronger way of getting to the question of dementia related to Alzheimer's disease and what the prognosis is going to be. These two plasma biomarkers are being utilized to some extent in the screening processes for clinical trials right now. The TRAILBLAZER-ALZ 2 study of Donanemab, that's Donanemab in early Alzheimer's disease, there was a subset of people that met the cognitive criteria who were pre-screened with plasma p-tau 181. The majority of patients that were that met the cognitive criteria were not, and those people just went straight on to getting a PET scan for amyloid and a PET scan for tau. If they didn't have the pre-screening with the p-tau 181, their positive yield was about 1 in 3 patients, and so then those would go on to be enrolled. However, if they screened positive with the p-tau 181, the positive yield on the PET scans was up to 2 out of 3. So I think this is a breath of fresh air for people that are designing clinical trials and figuring out how to use their money in a wise manner, because the PET scans are obviously very expensive, and that drains a lot of funds in research. But it's also demanding on patients as well compared to just having a blood test. So in the TRAILBLAZER-ALZ 3 study, that's also Donanemab, but it's looking at prevention of AD-related cognitive decline. They're utilizing the plasma p-tau 217 as a pre-screening measure. So I think this is probably a sign of things to come, where these plasma screenings will be an early stage before patients are enrolled in these studies.